Tents are going up in the parking lot of Sunnybrook Hospital in Toronto. It's a federal and provincial initiative to help free up hospital capacity that the pandemic has stretched to the limits.
The hope is that the shelter system will be ready sometime in the next few weeks.
Senior Director of Emergency Preparedness at Sunnybrook, Robert Burgess, says this 80 to 100 patient field hospital is to help all hospitals in the area deal with the pressures COVID-19 has placed on the healthcare system. And even though vaccines are expected to be rolled out at a much quicker pace now, there are still concerns about the weeks ahead.
And certainly there's been lots of discussion around the potential for increased COVID volumes, or a third wave as you described it. Our goal through this entire process, and from an emergency preparedness lens, which is really the way I look at these things, we plan for the worst and hope for the best.
As we first reported last Friday, Hamilton Health Sciences says a Wellington Street parking lot near the Hamilton General is currently being assessed as a potential site for an 80-bed structure to help with capacity. We asked the Ministry of Health why these field hospitals are popping up now, 1 year into the pandemic, but we have not yet received a response. This as the pandemic response unit in Burlington at Joseph Brant Hospital sits empty. There were patients in there from January until just a few weeks ago. However, the hospital says they no longer need the extra space. It's being converted to a mass vaccination clinic that will begin administering doses on Friday. The internal field hospitals at Oakville, Trafalgar, and Milton District Hospitals, on the other hand, are still in use. Halton Healthcare says while their occupancy fluctuates, they are usually near full capacity, and there is still no plan of taking them down. Health experts warning Ontarians not to let their guard down too soon. Kelly Botello, CHCH News.